So, as we dive into this topic, I want to remind everyone that our greatest wealth is health. As a double board certified child, adolescent, and adult psychiatrist, I work with tons of people all the time who are very driven and wanting to really increase their earning potential, really take the lead in the entrepreneurship space, and just have a lot of goals, which obviously there's nothing wrong with that. And working with professionals who are always setting the bar high and seeking to increase their income, we want to remember that our true wealth is our health. If we are not in a healthy state, it is very difficult for us to even enjoy a lot of those fruits. So, again, happy National Wellness Month. Happy August. I want to remind all of you that your greatest wealth is your health. Now, I'm from the South Side of Chicago. I attended University of Chicago in Hyde Park for undergrad after transferring from Dartmouth College, where I spent 1 year as a freshman, and then went on to complete my medical doctorate at the Pritzker School of Medicine at the University of Chicago. I then pursued a residency in psychiatry, adult psychiatry, and later specialized in child and adolescent. So I have worked in many different settings: outpatient, inpatient, group homes, juvenile detention, VA hospitals, private practice, and most recently, I joined my Amen family and started to learn more about the importance of brain imaging, especially as a psychiatrist, because we're the one specialty of medicine that still does not look at the organ that we treat on a regular basis. Instead, we use a diagnostic manual and symptom clusters in order to diagnose, while again, most of the time, never looking at a structural image of the brain, let alone a functional image. And growing up, one of my favorite movies was Lean on Me. And Dr. Joe Clark was lecturing this young man on the roof who had decided that he was going to start experimenting with drugs. And he said to him, "It kills your brain cells." And I really motivated in my space in my career to help people avoid just that, killing their brain cells. So when deciding to train with Dr. Amen and meeting his lovely wife, Tana, back in 2022, I just had so many hopes and expectations. And quite honestly, they have all been exceeded when it comes to the impact that being a trained spec provider has had on my ability to provide quality care, accurate diagnoses, and avoid a lot of the negative outcomes that can oftentimes accompany pursuing treatment within our Western medicine system. And I've learned so much about the importance of brain systems, brain function, how high or low brain activity is, understanding all of our biological systems and how they too impact our overall brain health. So it has been an amazing journey. And what we try to strive for every day as we work as professionals, clinicians with our patients is really to aim for having a better life through maintaining a better brain. If you think about it, our brain is really what makes us who we are. It dictates so much about how we interact with others, our thought process, all of our capabilities. And it's so important that we take the time to pour into our brain health on a daily basis, and it should just be routine. And what Dr. Amen always explains to us and his audience is that if you get your brain right, your mind will follow. We oftentimes use the term mental health, and that can come with a lot of other stigmatizing terms. And when you really think of the organ that is orchestrating this mental production, it's the brain. And if we start there, we definitely can improve our mental wellness outcomes. Whew. So, in medical school, I really became interested in our central nervous system. This is our central nervous system, and it's an electrical system. It is chemical, it's electrical, and it just does so much. I mean, you have to give it its respect. If you consider it your battery, if you consider all of these nerves as your wires and they are innervating and powering on muscles and powering on our ability to receive certain sensory inputs, it's literally the powerhouse. And so I decided to pursue psychiatry because one of the areas of brain function that I find very fascinating is when you think about the emotional functioning of the brain. When you think about how we experience moods, I also found learning more about thought disorders to be very, very interesting and have been able to, in the last few years, really understand how different brain systems impact those symptoms. So when we think about our brain, you want to remember that even though it makes up a mere 2% of our entire body weight, it consumes 20% of our energy production, which is huge. We have approximately 300 billion neurons, and they are all connected and interconnected. You want to remember that your brain is what we call plastic. It has the ability to consistently make new connections. So you don't want to see it as static. You want to understand that it is pliable. It is able to heal and regenerate not only blood vessels, but also nerve connections as well. And so it's super important that we prioritize taking care of the brain. And what is it that causes us to put our brain at risk in the first place? So, from the moment that we come into this world, right, there are risks all around us for injury. So, we're starting this new brain series through Amen Clinics, and I'm working as a spec partner. And each talk will really highlight certain important aspects of brain health. And so this talk, we're really going to just focus on physical injury. What causes us to have physical injuries of the brain? This is me. One reason why a person may have a physical injury, if you recognize these this lovely instrument right here. This is known as forceps. And when a woman is in labor and attempting to expel her beautiful new baby from her body, um, sometimes we use assistance, right, to help the baby come down the birth canal. One of the tools that was used more frequently with us in the past are your forceps. Forceps can cause a lot of injury to the brain. You want to remember your brain is very soft. And so I'm a forceps delivery baby. And when I learned more just about how that process could go so wrong, it's really made me pay more attention to people who I work with and being sure to ask that part of their history in terms of brain injury. Because a lot of times you'll ask someone, well, have you ever had any physical injuries to the brain? Nope. And they will say it faster than they answer any other question. And then you have to give more specifics, like, so you've never had a fall, you've never had whiplash, you've never fainted, just all of these different specifics that you want to make sure you screen for, because a lot of us have been taught for a injury to be what's the word that I'm looking for? For an injury to be impactful, you need to have had a concussion or you need to have lost consciousness. That is not true. Okay. So your brain is very soft. And if you take an instrument like this and squeeze on a newborn baby's head, you can result, you can see results of brain damage. bone and skull fractures, bruises, bleeding. We also can see seizures. A childhood friend of mine had her son delivered also through forceps delivery, and later on in life, he developed a seizure disorder. And at the time that he was in the hospital when he was delivered, they did confirm that he had had a bleed from the pressure that the forceps caused. So I'm showing you this to show from the moment we step into this world, there are risks all around us, and we don't want to ever shy away from talking about those risks. We want to make sure that we have open and honest conversations about them. You also want to consider all of your other biological systems when it comes to brain health. So your brain is connected to your respiratory system, which is your lungs, circulatory, which is your heart and all your blood vessels, arteries, and veins. It's definitely connected to the digestive system. Many people are aware that the bacteria in our gut help to make a lot of the neurotransmitters that our central nervous system uses. Our central nervous system uses chemicals like neurotransmitters and also electricity to function. We also have our excretory system, or what we would consider our urinary system, which consists of our kidneys and bladder and ureters. We have our muscular system. Sometimes we combine these two and refer to them as the musculoskeletal system. Integumentary system, which is your skin. Skin is the largest organ in the body, and you want to consider your skin as a great tool for not only detoxing when we use things like sauna and regular exercise, but it also forms a barrier to protect us and to keep pathogens out. Our immune system, that's your army, that is the source of all of your blood cells that are going to kill any bugs that are coming in. And we do get exposed to a lot of bugs that can impact our brain health. Endocrine system, you want to think hormones. We have 3 glands in our brain that make hormones: the pineal gland, the pituitary gland, the hypothalamus. We also have our thyroid, we have our pancreas, adrenal glands, ovaries, testes. So hugely important systems we're talking about here. And of course, our reproductive system. And taking those into account, these are some of the major brain health conditions that any of us can be exposed to. Traumatic brain injuries, loss of oxygen, that's that connection to your respiratory, concussions, a brain aneurysm, you want to think circulatory brain connection, skull fracture, that's your skeletal system connected to the brain, right? Brain tumors, hematomas, meningitis, consider your immune system, which causes inflammation. If you have an infection, stroke, again, you want to consider vascular toxins, think your skin, what we're exposed to in the environment. Adenomas can come from your endocrine system. Those are growths on glands that are in your brain, oftentimes the pituitary. Hydrocephalus, swelling of the brain. Encephalitis, cerebral palsy, again, think muscular system. If you damage brain tissue, then your muscles will be affected. A lot of babies are born with brain damage that leads to cerebral palsy, migraines, which also can come from injuries and also from certain toxins, and metabolic encephalopathy. So you want to think about your gastrointestinal system. Think about if your liver is not working, how that would affect your brain. Every single system is connected. The brain is part of your entire body. We are multisystemic. Now, if we focus on traumatic brain injuries, you want to first consider what are our risk factors: falls, motor vehicle accidents, sports injuries, violence, think intimate partner violence. Traumatic brain injury, one of the leading causes of it now happens to be intimate partner violence. Traumatic births, which we talked about, military combat explosions, workplace injuries, recreational activities like snowboarding, skateboarding, penetrating objects. This more so refers to firearms, uh, projectiles, child abuse from physical abuse, think shaken baby. And you always want to remember that a traumatic brain injury is going to vary in terms of the long-term impact that it will have based on where the injury occurred, what major brain system, your age, your overall health, which is what we refer to as your brain reserve. So let's remember real key points here. Our brains are very, very soft, similar to the texture of soft butter. Our brains float inside of our skull, and our skull has very hard, bony ridges, which do cause injury to brain tissues. And when we are hit in the head in any kind of way, this very delicate organ is forced into some of the sharp, bony ridges inside of the skull. And if you continue to have those types of injuries on repeat, which some of us are exposed to, depending on the work that we do, if we are engaged on a regular basis in recreational activities that also include contact to the head, if we think about contact sports, just keep in mind that repeat injuries over time can negatively impact our brain function. When we know we've had an injury and it leads to us pursuing some type of image to determine how injured am I and where is my injury, we proceed usually with what we call a structural image. So you want to remember that when you go to the ER, if you have a person presenting because they're paralyzed or they're having seizures or a suspected brain injury, they're usually going to be evaluated with an MRI or a CT scan. These are structural scans, meaning that they are really good at detecting bleeds, fractures of the skull, but there's a lot of information that they don't give us. And oftentimes, when they are performed and a person has had a significant brain injury, they're told everything is fine. Okay. So, how do we know we're fine if we didn't really look, right? You have to have the right tool in order to get the right information. So there are different types of imaging tools that we use in the healthcare space. Functional brain imaging tools like SPECT, that's SPECT, give us additional information that oftentimes a structural imaging tool will have us to miss. So SPECT looks at blood flow, which tells us brain activity, oxygenation. It gives us information about how well is your brain functioning, not whether or not you're showing that you have a mass growing or you have a fracture in your skull or you have a epidural hematoma. What it's letting us know here is, are those cells showing good activity and good oxygenation and blood flow, or are they showing us something else? So the major benefits from SPECT imaging, which is the type of imaging that we use at Amen Clinics, is that we're able to look at blood flow, which gives us good information about brain activity. We can also look at the impact that injuries have had on function, because even though structurally everything looks great, we can see if you are struggling with decreased activity in these areas where the neurons have been hit or are inflamed. We're also able to gain information about any potential toxins, infections, and we also get good feedback from SPECT imaging on emotional functioning as well. So it has really, really great benefits that allow us to not only properly diagnose and work up conditions so that a person is getting an accurate, functional diagnostic picture, but it also allows us to show a person in real time, this is what your brain looks like today. But the key is you can always change it. You can always take a baseline SPECT and look at imaging post any type of injury, and you can implement a healing plan or regimen protocol and come back and actually see how you've benefited. If you think about diagnosing individuals while using symptom clusters only, a lot of times we end up misdiagnosing. And when individuals come in for diagnostic purposes, we can sometimes see up to 79% of those individuals have something changed or included in their diagnosis that then further shapes their treatment plan in a more individualized and appropriate way. Even if we're the healthiest that we could possibly be, if we never leave our home or drive our car or put ourselves in any situation to have a hit to the head, we still lose neurons every day. So this shows you over time, when you think about brain activity on the surface of SPECT, you want to remember that color means nothing. We're looking at shape and appearance. Notice how you don't see any holes or what appears to be holes. These are not physical holes, but these are areas with lower brain activity. And so it looks like a hole. Well, over time, as we lose neurons, this would be the natural progression of an aging brain. And what we know, though, is that how we live, what we're exposed to, whether it's occupationally, whether it's recreationally, whether it's how we are in our relationships, again, going back to intimate partner violence being a risk for brain injury, that will then dictate how our brains age. So having a history of physical trauma to the brain does increase our risk for dementia. And we always want to do everything that we can to restore those neurons, to restore those connections. And there are lots of ways that you can intentionally make time to build your brain, build a better brain. That's what you want to do. If you think about what we see with imaging, we're able to see Alzheimer's earlier on before it gets to the point where you've lost all of your activity in your parietal lobes. We also are able to show individuals when they, let's say, use the method of inhalation to use cannabis or tobacco. We can show how that loss of oxygen shows up. Also, we're able to see the frontal lobe, which you want to think of as the CEO of the brain. And with traumatic brain injuries, we can see very large areas of decreased activity, especially post things like motor vehicle accidents, or if you think about athletes that may have recently had a concussion. When we view the SPECT image, we're able to see the level of brain activity. And so let's summarize the focus for this talk, which is brain injury, physical brain injury. So our major risk factors: falls, motor vehicle crashes, assaults, firearms, intimate partner violence, sports injuries, blast injuries, being struck by an object. These are all things that we want to avoid if we can, but we know that as we live, depending on what we're exposed to for certain reasons, they're not avoidable risks. So what can we do to take our control over how our brain ages? That's key. First, you want to really know how brain injury impacts the brain. You want to be able to explain it to another person. You want to be able to use the precautionary measures that are needed in order to lower your risk. We also have to be specific. Are we talking about focal injuries or more diffuse injuries, meaning that there are multiple areas of the brain that are now affected? We also want to consider concussions. How do we recover from concussions? Hematomas, if those have happened, contusions, which is bruising of the brain, any fractures, and CTE, which is chronic traumatic encephalopathy. Again, that goes back to my original point of the brain being so soft and inside of this hard shell, and repeat small hits definitely have a negative impact. And we use the term chronic traumatic encephalopathy to reference the loss of neurons, damage of neurons, oftentimes in the temporal lobes, that lead to symptoms of CTE, which can also include mood dysregulation, irritability, agitation, slower processing speed, so many functions that we want to consider when we are talking about brain injuries. So my other recap for you is BrainSpect is one of the best tools available to identify areas of the brain hurt by different activities. We also want to consider that the CT and MRI is there to show us the structure and anatomy. And we really want to use functional imaging so that we can have more accuracy with diagnoses. Consider your professional athletes. Consider the love of football or the agility and speed and commitment and training that goes into professional boxing, or think about your bare knuckle fighters, think about MMA. Just think about all of these areas of expertise and skill that will place your brain in a very vulnerable position when it comes to risk for physical injury. This is an example of what we've seen with our research study with NFL players who have experienced repeat hits to the head, and we can see clearly areas that are lower in activity due to the history of physical trauma. And the beautiful thing is there's something you can do about it. There's no reason to sit and not be resourceful. Be resourceful. Don't be ashamed to acknowledge that we're all subjected to different environments, different activities that can increase our risk for injury in one way or another. And let's just be proactive about addressing it and protecting it. I'm not sure why the study didn't show up here, but I'm going to go on to the next slide. It's super important for you to have a baseline knowledge of your different major brain systems that we're able to see on the surface and that are susceptible to these injuries. So if you think about your frontal lobe, which is right behind the forehead, I love to call this area the CEO of the brain. It's responsible for not only a lot of our motor function, but also reasoning, behavior, memory, more working memory, how we make decisions, also plays a huge role in our personality and how we show up and socialize with others, judgment, how inhibited or disinhibited we are. Next, we have our temporal lobe. And if you look at the temporal lobe, think about how it sits right on the floor of your skull. And the floor of your skull has these two bony ridges that are sticking up. And anytime you hit your head, either here or here, and you get this rocking motion, your temporal lobes are bumping up against these bony protrusions. And the temporal lobes, super important, sitting right behind the ears. Think language comprehension, taking in all those sounds. Think also behavior. A lot of times when people have had injuries here, they struggle with temper. So I think temporal temper. Long-term memory is here. Your hippocampus, think your hard drive where you are storing information. And also your amygdala is here, which can lead to more anxiety, some paranoia. Am I safe? Am I not? We next have the parietals. Here you want to consider a lot of sensory input, sensory. How does touch feel? being able to know how your body is in space and time, direction sense, also reading and writing and math calculations, being able to tell your left from right. Our occipital lobe, which is in the back, is vision. Think we take light into our pupils and it goes directly to the back of your brain to get processed in such a fast amount of time is almost unbelievable. And then we have our cerebellum. Your cerebellum sits underneath the occipital lobe. And this is where we actually have half of our neurons in one space. It's a super, super important structure that helps with balance, coordination, our fine motor, fine muscle control. Think if I am intoxicated with alcohol and I'm asked to walk a straight line and I can't, it's because alcohol is a toxin that hugely impacts cerebellar function. And lastly, we have the brainstem. Think all things autonomic. Think breathing, blood pressure, heartbeat, swallowing reflex, all things automatic, autonomic. Therefore, the brainstem dives down and creates your spinal cord, which then gives way to all of those wires that we saw in the other picture. You really need to have a solid baseline understanding of these major brain systems, and then you'll get a better understanding as to how a physical injury may impact certain symptoms. So, what are those symptoms that we can see with physical injury? Headaches, for sure. Post-traumatic migraines can be a big issue. Cervical pain, if it involves your neck, think whiplash or how you land. Neck pain can be very, very, very debilitating. And when you think about people who struggle with chronic pain, it doesn't take long sometimes for it to impact their mood. Oculomotor symptoms, so think your eye movements, confusion, changes in your speech, feeling lightheaded, dizzy, blurry vision, tired eyes, ringing in your ears, bad taste in your mouth, being tired. Change in sleep patterns can be huge. And here's the thing about sleep. When you really look at how useful sleep is, when we're sleeping, our brain is it's making new connections and it's taking out the trash. It's detoxing. If you are unable to get sleep because you have had an injury that is impacting your circadian rhythm, right? Think about those glands that are deep within the brain. When you have an injury, those two can be impacted. Right here, they're showing you the pituitary gland. Think about hormones, growth, fertility. Your brain includes your endocrine system. We call it the neuroendocrine system. So if I have an injury, can I possibly injure the gland too? Uh-huh. And how would we know? You have to check the labs in order to see what hormone levels are showing up as. That's how you continue to work this up. So I want all of you listening to this talk to please understand that the goal is to develop a little brain envy. The goal is to use your brain as one of the sharpest tools in your toolkit, and on purpose, make sure that you are giving it all of the ingredients that it needs in order to thrive. What do we use at Amen Clinics as part of a concussion rescue protocol? Hyperbaric oxygen is hugely important. Your brain uses a ton of oxygen. Think about it. How long can you go without oxygen before you have permanent neuron death? Not very long. So that's how important oxygen is. Oxygen is used for healing in many other different areas of health and wellness. But for the purposes of what we're discussing today, when you talk about hyperbarics, you're talking about exposing your body, your brain to high pressurized oxygen, which has healing properties that are, I mean, amazing. It's one of the major tools that we use when a person comes in with a concussion and then they go through their weeks of HBOT or they get an HBOT for their home. And when we respect them, the activity change is undeniable. Neuro rehab, which can include obviously speech, and you want to consider occupational, physical, neurofeedback, stem cell treatments are also being used to help with um, healing from injuries. Hormone evaluations, I just mentioned. We always try to use nutraceuticals over pharmaceuticals. You want to think what helps your brain heal, blood flow, ginkgo biloba. You want to think what helps with decreasing that inflammation that comes from the injury. Think of it like a sore, it's inflamed. Huperzine A, polyphenols. Nutraceuticals are your friend when it comes to brain health, maintenance, and rehab. Think about your good fatty acids, your omega-3s. Your brain is mostly fat, okay? And it needs fat in order to make that wiring, that myelin, super, super important. Psychotherapy, integrative medicine, if we are starting off assessing brain injury and we find other evidence of, let's say, pre-existing diagnoses that may have made you more susceptible to the negative impacts of a concussion, we're going to want to address that. A lot of times we see different viruses that a person may have, like mono or past exposure to strep. That alone can increase inflammation. We also always talk about nutrition and give feedback about nutrition and use medications when needed. Remember, the electricity in the brain is so important. It is vital. Blood flow, polyphenols, flavonoids. For the membrane integrity, the membrane of the cell, you need your fatty acids, DHA, EPA, vitamin C and E are great as well. Vitamin D also helps with your neuron development. So think vitamin D, neuron development. For the nerves to actually communicate and for the signal to travel, you need the fatty acids, as I mentioned, B vitamins, huge, and iron. Homocysteine, choline really helps with how we cleanse. Think again what I mentioned earlier, being able to get rid of byproducts when we're asleep, awake. If your brain is a hugely metabolically active organ, it's going to make trash. You have to take out the trash. The metabolism of your energy highly dependent upon CoQ10, manganese, iron. And again, B6 is super important for postsynaptic signaling. I want you to take this with you. To have a bright mind, you have to start with blood flow. If you're sedentary, if you're not working out, not going to work for you in the long run with brain health. Retirement and aging is R. I mentioned we lose neurons every day. Inflammation, we don't want inflammation in the brain. Genetics, some of us have genes that increase our risk for neuron injury or neuron damage. We can test for that. Head injuries, I already mentioned, you want to assess. Don't be so quick to say, no, I've never had a head injury. Think about all of the things that were on the list that can lead to injuring that very soft like butter brain. Toxins, we're exposed to them every day, from your plastic water bottles to molds for those of us that may live in more humid areas or climates. People who've lived in water damaged buildings, think about all the toxins that we're around from pesticides, what's sprayed on our food. Functional testing can test for environmental toxins and mycotoxins. Mental health, we want to make sure that we are taking care of our emotional well-being, that we are addressing all experiences and life struggles and stressors that impact our mood and how we're showing up. That's your emotional intelligence. Immunity and infections, always want to have an optimized immune system. It is your army. It keeps the pathogens out. And we want to make sure that if we've been exposed to infections, that we know about it. I have seen so many people that present with a history of tick bites, and they have exposure to the bacteria Borrelia that causes Lyme disease. And that can even present like depression or with rheumatoid disorder, right? make sure you get checked for infections. Hormones, nothing to ignore. I already mentioned head injuries can impact hormones. We can test for that. Diabetes, we know that being overweight is not healthy to our central nervous system. And some recent studies have shown a correlation between brain size and your waist circumference, and it's inverse. So the uh, higher your waist circumference, the smaller the brain. Size does matter when it comes to the brain. You don't want a little brain. You don't want a shriveled, shrunk brain, right? You want it to be hydrated, not injured, not inflamed, and ready to help you execute in whatever it is that you're doing career-wise, in your personal life, in your relationships. Sleep, hugely important. Can't say that enough. A lot of people lose oxygen at night because of untreated sleep apnea. So keep remembering your bright minds. Put that up somewhere where you can go back and you can review. And lastly, I want to leave you with just daily tips on how to decrease inflammation. We're seeing a huge increase in the occurrence of dementia. And we know at the root of a lot of those neurons being damaged, whether it's because of the foods that we eat or the toxins, there's inflammation. If you are in a activity that consistently exposes you to any head injuries, whether it's recreational or it's professional, and you want to optimize your brain health by decreasing inflammation, number one, your oral care is key. You need to floss daily and take care of your gums. There are studies that show that bacteria in the mouth can increase the risk of inflammation in the brain and the onset of dementia. We want to test in your labs your C-reactive protein, which is an inflammatory marker that we oftentimes check. Your omega-3s, think your good fatty acids. We just saw you need those for those cellular membranes. We also want to rule out the presence of any past pathogen exposure, treat them if needed. Try to stay away from your trans fats. Limit your omega-6 rich foods. Please, the deep fried, the battered, please. You want to increase avocados, increase nuts, walnuts. If you're not allergic to fish, your wild caught fish. Omega-3 supplements are so helpful. Your B vitamins, just think B vitamins for the brain, your B9, B6, B12, folate, all are super important for that neuron function. You cannot have a healthy brain with an unhealthy gut. So we want to make sure that we're not trying to keep our brain from being inflamed, but we got an inflamed gut. Can't eat inflammatory foods, junk foods, all of those different additives and things that are just not good for our performance. And we want to make sure that we know what our gut health looks like. We can check our gut health. We can look to see what good bacteria is there, what bad bacteria, overgrowth of yeast, so many ways that you can protect your brain and continue to preserve all of those healthy functions. I'm excited to work with anyone who is interested in SPECT imaging and doing a functional deep dive. My contact information is here. Please do not hesitate to visit my website, drgettings.com. Please do follow me on all major platforms. I am Dr. Gettings on all major platforms. And if you want to learn more about pursuing SPECT imaging, learning about nutraceuticals that help preserve brain health, we don't have to be afraid to talk about injuries. We're all susceptible to a certain level, and we need to have more open conversations about it and be proactive, especially my professional athletes. I truly feel that you should be at the forefront of this messaging because your major asset for how you show up and thrive every day is on the front line, right? And so you need to be the expert that can tell a room full of people who've never heard this